In the ICU rounds, while we are seeing the patient, the first year resident noted a peculiar finding in the nearby bed where the uro bag or the urinary bag along with the tubing was not in normal color and it was in purple color as shown in the image. So whether it is normal or what is the abnormality was the doubt the resident was having. The topic of discussion for today is related to that, purple bag syndrome or purple bag urinary syndrome. The urinary bag became purple in color. First, what is it? It is a benign condition where the urinary tubing and the bag became purple in color because of some kind of reaction secondary to bacterial action. This is called purple bag urinary syndrome. Basically, it is a benign condition. Second question, why it occurs? Why the color is not yellow or transparent or not normal? Because of the particular amino acid tryptophan from the patient body gets metabolized, some compound called indoxyl sulfate being formed. Once it is excreted in the kidney, the presence of gram-negative bacilli, gram-negative, this is an MCQ point, gram-negative bacilli causes this. That produces enzyme like sulfatase and phosphatase. Sulfatase and phosphatase that leads to metabolism of this indoxyl sulfate, resulting in formation of some compounds which have indirubin or indigo compound. Some reaction, gram-negative bacilli, leading to some compound formation that is indirubin and indigo. When it reacts with the tubing and the uro bag, the compound most commonly being polyvinyl chloride leads to development of this purple color. So that is why how it occurs. Because of the particular amino acid, gram-negative bacilli metabolizing reacts with the tube, leading to the purple color. In this, the gram-negative bacilli, what are the things most commonly we encounter? Klebsiella, Pseudomonas E. coli, Providentia. Providentia is a bit rare clinically. These three are very common. The gram-negative bacilli. A multiple choice question option is gram-negative bacilli. It is not gram-positive. Okay, we have seen what is it. We have seen why it occurs. What are all the risk factors? Do all the patient know? No, all the patient won't develop. In ICU, this kind of finding, if it is a non-nephrological ICU, rarely you will come across. In nephrology ICU, more often. Even that more often indicates once in 3 months or once in 4 months, not on a daily basis. So what is the risk factor? Why the patient developed this? First risk factor is the UTI. Second important one, the chronicity of the tube. The Foley's catheter, what is the chronicity? Is the second one. Third, female gender. Fourth, constipation. The 4 important risk factor. Female gender, why? Nothing special, because of increased risk of UTI. UTI, long stand tubing, the chronicity, which is the most important one out of all this. Chronicity. Okay. If the tube is there for a longer period of time, of course, there is a chance it will develop. So risk factor we have seen. Coming to the treatment, is there any particular treatment for that purple bag is required? Particular treatment for that bag is not required. It is a benign condition, but particular treatment is required for the UTI. If the patient is having chronic UTI, antibiotic might be required to treat the UTI. Once you treat the UTI, this will get resolved. Constipation have to be taken care of. First of all, you have to change the bag and that urinary tubing, so that unnecessary concern or apprehension among the staff members or the family member won't be there. Otherwise, they will be so much apprehensive why this color changes. So overall, no specific treatment. Change the tubing and the bag. Treat the UTI. If the patient is having UTI, treat it, it will resolve. So this is all regarding purple bag urinary syndrome. And once you come across this kind of uro bag in your ICU, don't get apprehensive. It is a benign condition, it will resolve. But start the hunt for UTI. UTI, treat it. Chronicity. That's all. MCQ point, gram-negative bacilli. Which one? Indoxin sulfate, amino acid is tryptophan. These are 4 important MCQ related stuff, and it's all regarding purple bag urinary syndrome. Bye bye.